Hi guys, this is Allie Garcia, one of the class of 2007, Hawk ball player for 2 years, and one of your inaugural 40 under 40 alum. I'm coming at you from Brooklyn, New York, from my main hospital, New York Presbyterian, to give you a little insight on the COVID pandemic and how we've been handling it here. First and foremost, I have to applaud all of the healthcare workers, not even just healthcare workers, environmental staff, transport team, radiology teams, everybody that's involved in this, because it truly has been a stressful situation. Coming here, pushing 13-hour days, 5-6 days a week, nights, weekends, everything, you name it. You know, some people are going without bathroom breaks, some people are missing meals. It's just been something that's been kind of overwhelming for everybody here. First and foremost, with the beginning of the COVID pandemic, we were seeing a very, very high influx of patients, and they decided to cancel doing elective surgeries. So a physician assistant like myself that primarily works in neurosurgery and stroke, we were no longer doing elective cases. We had shut down the ORs, and we started helping out and becoming basically COVID specialists. So what happened was we got diverted to other departments, and we wound up basically helping out and kind of putting in where we could to help patient care and to kind of help in terms of critical care, patient care, line placements, everything else that the hospital would need. In terms of at that point, we were very, very low on PPE. You know, now the PPE is getting a little bit better so we can get better access for everybody. But at the onset, you know, there was a lot of fear in a lot of us as to, you know, we're here and we're helping and we don't mind doing that, but what are our chances? And in fact, there are a lot of staff that are positive at this point for COVID, but if they don't show symptoms, they're asked to come back and work because we are really in dire need of our medical clinicians. So, you know, people really are putting their best foot forward here. When you arrive to our hospital, basically what we have set up is an outdoor triage. So behind me right now, you're gonna see an extensive length of what we call our outdoor morgue. This is an idea. This is one of the 2 actual trucks that we had to facilitate as a morgue. But this one now we are down to 1, which is very good. This morgue extends all the way around. So I'm gonna pass the porta-johns and give you a little bit of a look. But this morgue actually extends all the way around to the entrance of the hospital. It's a refrigerated morgue and it fits over 100 bodies. At the beginning of this pandemic, we were easily putting 10 to 15 bodies in this morgue, and that's not an exaggeration. You know, it was tough. We weren't able, our inside morgue was full, the outside morgue was being full, and it was such a depressive moment for all the staff here. Even as the pandemic ensued, basically what we had to do was separate triage areas. So our operating rooms were shut down, our ambulatory care center was turned into an ICU, most of our units were turned into an ICU. We had transported all of our pediatric patients out to pediatric hospitals and made the pediatric unit an entire COVID unit, an ICU unit. So as of right now, I can honestly say a majority of our hospital is COVID positive. So what I tell people all the time, and I'm telling you guys out there, is unless you feel like you need intensive care and you need to be treated for something that is life-threatening, stay home. There is a very, very high chance that you will acquire COVID just by coming to be treated. So it's really a serious issue. If anything, it's being downplayed. I mean, you could see the extent of this morgue behind me. This is not a joke. And this is us at a good period in this COVID pandemic. When it was a bad period, there were hospitals in New York that had 2 or 3 trucks that were outside their facilities. So this is something that is seriously, seriously bad. In terms of when you come here, what we do here is we triage people that are saturating with an oxygen level over 90% outside in our outdoor tent. So this is our outdoor triage tent. This was set up for people who were too healthy, that maybe we didn't want to put them in with sicker patients. And we decided to triage them here, treat them here, give them treatments, and send them home. And then at that time, we were doing tests that came back with results in 72 hours. Now we're actually getting to more rapid tests that are giving us better information in quicker intervals. However, you know, we're still getting an influx of patients. We're still with very high volumes of people on ventilators. And it's unfortunately a real serious issue. So, you know, it's something that when we say follow the CDC recommendations, we mean follow the CDC recommendations. This is a public health problem that only has a public health solution, and it starts with all of you guys out there making sure you wear your mask, making sure you keep your social distancing. Here, I can't even tell you psychologically what this has done to a lot of our staff. There was a point where most of us didn't even feel like we could do anything no matter how much we tried, and it's finally getting to an alleviated point where we could say, okay, there are some people that we're able to save, and there are some people that we're able to get home, and it's to the point where when we are able to get people home, we physically celebrate, we dance, we sing to them on their way out the door, because it's something that is so rare, and I just want you guys to understand that this is really an issue. If at any point you guys have questions, concerns, anything you want to ask about the COVID pandemic, anything you want to ask about physician assistants, their role in this whole process, please feel free to reach out to me. The Alumni Board has my contact information. Coach has my contact information. I have no problem answering any questions. But from here on out, guys, if you hear it, I'm telling you right now, it is serious, it is a problem, and just take care of yourselves. Be able to be safe so that you can keep on doing the things you love doing and keep on playing ball and anything else that you love to do. So again, I'm Allie, physician assistant, signing off from Brooklyn. I hope to see you guys all well, and take care.